So I now have the honor of introducing Dr. Sarah Moyer. Dr. Moyer is the Chief Medical Officer for Humana Healthy Horizons in Kentucky, Humana's Kentucky Medicaid business. Previously, she served as the Director of Louisville Metro Department of Public Health and Wellness throughout the COVID-19 pandemic and the opioid epidemic, and as the Quality Improvement Director while faculty at the University of Louisville School of Medicine. Dr. Moyer, a board-certified family physician, believes engaging all parts of the community to implement bold, innovative ideas will lead to improved healthcare outcomes for everyone. Dr. Moyer received her master's in public health from Dartmouth College, her medical degree from Temple University, and completed her residency at Wake Forest. She now calls Louisville, Kentucky home and enjoys spending her free time with her husband and her 4 children. Dr. Moyer?
Good morning, everyone. Thanks for joining us here on this beautiful fall day. As Dr. Taylor gracefully introduced me, I am Dr. Sarah Moyer. I am the Chief Medical Officer for Humana Healthy Horizons in Kentucky, a family physician who's dedicated career so far to trying to improve health for everyone. I'm grateful to be here today. I see a lot of familiar faces from all different parts of my career, so thank you. So it's no secret that our healthcare system is expensive. We've heard that all morning long. It has poor outcomes and fails to incentivize health. But what if there's a solution that benefits both our healthcare workforce and our patients, us in the healthcare system? And that is what we're talking about today. Let's see if this works. All right, so I want to start by acknowledging the challenges that we face. Our healthcare system is the most expensive in the world. It's head and shoulders above every other country on earth in terms of cost, and twice as much as other high-income countries. You might say that's fine. We're richer, we value health, that's where we want to spend our money. Well, unfortunately, despite our high spending, we aren't getting the best health or even best health outcomes. So, in fact, we rank among the lowest of other wealthy countries when it comes to many measures, including quality, access, efficiency, equity. Our life expectancy is below average, and we have higher hospitalization rates for common diseases such as asthma, COPD, heart failure, diabetes, mental health. So in fact, we aren't getting a lot of value from our healthcare spending. That is, we don't have good health outcomes for the high amount we spend. And that's what we define as value, both more generally and in the context of healthcare. Value is quality and good health, good outcomes divided by cost. That's how much health I'm getting for every dollar I spend. So our healthcare system is often characterized by skyrocketing costs, fragmented care, heavy emphasis on treating acute illness rather than preventing them. Primary care and public health are often the foundation of a healthy society, and it often takes a backseat to specialized care here in the U.S., resulting in a lot of missed opportunities for early intervention and comprehensive health management. We know primary care saves lives and saves money. For every dollar invested in primary care, the healthcare system realizes savings of $13 in other services, and catching problems early, which happens during annual checkups, preventative visits, is much better than treating severe or advanced illness. We all know this. Public health, you can make the same cost scenarios even higher and more. I know there's a lot of public health people in the audience today. But we also know our system is not designed for primary care. Too few doctors are entering primary care. Too many, including me, are burning out too soon. The current fee-for-service model is an economic model built on volume, which is created the hamster wheel that we're seeing now, where Physicians, office visits want to see more people, and the incentive is sick care rather than preventative care, furthering this cycle of burnout. Value-based care models helps close that income gap between primary care and other specialists, provides financial incentives for providers to focus on high-quality primary care, and reduces the workforce burdens and primary care office closures. So to address these issues, we have to re-architect our healthcare system towards integrated chronic care management. By shifting the focus from the acute events to ongoing chronic care, we're going to reduce costs in the long term. So historically, we've seen healthcare financing as an insurance product, like you would for car insurance, random, unpredictable, life-changing events. But as chronic disease burden grows in our country, healthcare events, they're not random, they're predictable. We know when they're going to happen, and they happen throughout our entire lives. So trying to change the model of healthcare financing from less insurance to more of a subscription service be fundamental, really shift in the economic model of healthcare. And it's not just for the business model, it's also a shift in the clinical care model, leading to better outcomes. So at Humana, we strongly believe that the greater coordination there is between the payer side and the delivery side of healthcare enable greater interoperability of data, greater partnerships, and it really helps to keep our members and patients healthy and out of the hospital enjoying their best life. So we're a payer organization with a large footprint in Medicare Advantage and a small but growing footprint in Medicaid, which I help lead here in Kentucky. But we're also a healthcare delivery organization with several clinical businesses, including the nation's largest senior-focused primary care clinic organization called CenterWell. The main point here just being that we have experience with value-based care from multiple perspectives, specifically the payer and provider side of the organization. And so for the clinicians, I know there's a lot of providers in the room today. I often get asked, okay, well, I get the concept, but what does it actually look like in the clinic? Well, first, it's a shift in mindset. Providers must embrace the patient-centered approach, understanding that the patient's well-being extends beyond the walls of their office, need to collaborate with other healthcare professionals like community health workers, pharmacists, social workers, forming care teams that work together to provide integrated, coordinated care. Additionally, technology plays a really important role in enabling value-based care. Electronic health records, data analytics, telemedicine platforms really facilitate the change to better communication, data sharing, and monitoring. These tools empower healthcare professionals to make informed decisions, and I would also argue others in the community as well, as we heard from first thing this morning. They can track their patient's progress, identify areas for improvement, and really focus on the health of the patient instead of just what's in front of their eyes that moment. And it's really amazing to see the sense of innovation and freedom that happens when you get paid for outcomes instead of the number of people you see in your office that day. Patients get healthier, and providers get the joy back to practicing medicine. And it works. We've been tracking data, results for value-based care for the last 10 years now at Humana. And we found that value-based care leads to a more integrated approach to care that successfully incentivizes the outcomes and quality that we want. We have 4.4 million members across the country in value-based contracts right now. That's about 2/3 of our membership. Our patients see providers in value-based agreements experience better health outcomes, receive more preventative screenings, spend less time in the hospital, and experience lower healthcare costs than those affiliated with the traditional fee-for-service type contracts. So you can see some of the data here. And it's not just better outcomes. It's also greater patient engagement. less use of low-value services, higher patient satisfaction scores, and greater use of innovative solutions and more flexible care models, such as the use of telemedicine. So it sounds awesome. I would want my doctor to start today. I would tell you that Kentucky, much like some of the data we saw earlier, is behind a lot of the rest of the country. And so we're here to help. We've got the tools to help move you on the continuum from traditional fee-for-service all the way up through downsized risk. And so first step is usually just evaluating the data, systems you have, your ability to really manage your population, and go in a value-based contract that's just pay for performance, so extra payments for meeting quality metrics. The next step is shared savings, so it's really just upside risk, meaning that if you save money, have better outcomes, meet the quality metrics, we split the funding that is shared in that healthcare savings cost. So if you do great, you get to share the savings. And then the full value-based contract, downside risk, is you take on all that risk, but you get 100% of the savings, but you're also at risk if your patient's health or healthcare spending goes in the other direction. And there's tools to get there. So we heard they're not available to everyone, but we've got really robust data analytics and reporting, help you get access to our population health analytics suite, Compass, financial reporting, so all the tools needed to be able to succeed in a value-based type contract. EMR, interoperability, being able to help you track your data, understand the population that you're serving and how to make your patients healthier, and support resources as well too. And then if you're not there yet, still trying to help you with incentives. These are some of the things we see practices going to themselves, but have incentives for meeting all of the quality metrics that we've heard other talks about, as well as the preventative screening. We not just pay the provider, also helping to incentivize our patients as well for completing the things that they want to along the path. And then same thing, value-added services, expanded benefits, things that we know help keep people healthier and out of the hospital. And so whether it's helping with meals after you're in the hospital or doula services, things that aren't traditionally paid for in the traditional fee-for-service, we offer those as benefits. And I'm saying I'm here representing Humana, but this is most insurers, payers offer all the same things. And so if you go on DMS's website, for Medicaid at least, you could see it. Medicare is in, I think, open enrollment here soon in a few days. You can see all the benefits that they offer as well. So that is the end of my slides. Before we go on to, if you see these later, there are some great, if you click on this, a great patient story. It's a quick little video there. But really by embracing value-based care, I really think it's one step to transforming our healthcare system, and one that prioritizes prevention, collaboration, and patient well-being. Healthcare professionals are experiencing greater satisfaction, really seeing the positive impact on their patients' lives. And patients in turn benefit from improved access to care, better health outcomes, and reduced costs. So path to more sustainable future. I have hope that value-based care can help us get there. So thank you.